Hey everyone, welcome back to the channel. If you or your parents are on Medicare, you probably think it covers most healthcare needs: doctor visits, hospital stays, maybe even physical therapy. But here's the thing nobody tells you until it's too late: there are big gaps. The kind that only show up when you actually need care. You think you're covered, and suddenly, you're staring at a bill for thousands of dollars. Today, we're going to break down 10 surprising things Medicare doesn't cover, and more importantly, how to protect yourself, your family, and your wallet. Stick around until the end, because I'm sharing a bonus strategy that could save you thousands of dollars every single year. Let's start with one of the biggest surprises: dental care. Most people assume Medicare covers your cleanings, fillings, or dentures. It doesn't. None of it. If you need a root canal, an extraction, a new set of dentures, those costs are entirely on you. The only time Medicare steps in is if dental work is directly related to another covered procedure, like jaw surgery after an accident. But routine care, completely out of pocket. This matters more than people realize, because oral health connects to overall health. Gum disease can increase heart problems, infections, even dementia risk. The fix is simple: get a supplemental dental plan, or find a Medicare Advantage plan that includes dental coverage. And if you're still working, get major dental work done while you have employer insurance. It can save you thousands. Next up, vision care. If you need glasses or contacts, you'll need to pay for them yourself. Medicare covers cataract surgery or glaucoma treatments, but routine eye exams, frames, and lenses, not covered. It's a huge blind spot, pun intended, because as we age, our eyes change faster. The solution is similar to dental. Some Medicare Advantage plans include vision benefits, and you can also buy standalone vision insurance for around $10 a month. But don't skip your annual exams. A simple test can catch eye diseases early and prevent permanent vision loss. And that's worth far more than the cost of a new pair of glasses. Let's move on to hearing aids. This one hits hard. Hearing aids can cost anywhere from $1,000 to $6,000 a pair, and Medicare won't cover them. They won't even pay for the exam to fit them, unless it's part of a medical evaluation for hearing loss ordered by your doctor. Imagine missing out on conversations with your grandkids, or constantly saying "what?" because you can't afford hearing aids. It's heartbreaking and avoidable. There's good news though: new over-the-counter hearing aids have been approved by the FDA, and are available for mild to moderate hearing loss at a fraction of the price. Some Advantage plans also offer partial coverage, so check your options carefully. Now, chiropractic care. A lot of people rely on chiropractors for back pain and mobility, but Medicare only covers one service: manual manipulation of the spine, to correct a subluxation. Everything else, x-rays, exams, massages, is on you. It's confusing because you might assume that since it's related to pain relief, it's medical, but Medicare draws a strict line. If chiropractic care is part of your regular routine, ask your provider if they offer a senior discount, package deals, or see if a Medicare Advantage plan includes those visits. Here's one you might expect: cosmetic surgery. Medicare won't cover anything purely cosmetic. Facelifts, liposuction, Botox, tummy tucks, no matter how great they make you feel, if they're elective, you're paying for them yourself. The only exception is if it's medically necessary, for example, reconstructive surgery after an accident or to correct a birth defect. So if you're considering any type of elective cosmetic procedure, plan ahead and save up. Massage therapy and acupuncture are another gray area that catches people off guard. Medicare generally doesn't cover massage therapy, even for pain management. Acupuncture is covered only in very specific cases, like chronic lower back pain, and even then, only up to a certain number of sessions. If you use these therapies regularly, that can add up fast. But you can work with your doctor to find alternative, covered options for pain management, like physical therapy or supervised exercise programs. Or, again, choose a Medicare Advantage plan that includes more holistic benefits. Let's talk about feet. Routine foot care: trimming nails, removing calluses, or general foot maintenance isn't covered either, unless you have a medical condition like diabetes or severe nerve damage that makes foot care medically necessary. You'll be paying out of pocket. This one sneaks up on people, especially diabetics, who often need specialized care. The key is documentation. If you have diabetes or a chronic condition that affects your feet, Make sure your doctor writes that down. Proper documentation can mean the difference between full coverage and a hefty bill. Now here's one that shocks a lot of retirees. Medicare doesn't cover medical care outside the United States. If you travel abroad and get sick or injured, you're on your own. Even emergency care is usually excluded. There are a few limited exceptions, like if you're in the U.S., but the nearest hospital is across the border in Canada or Mexico. But for international travel, you'll want to get travel insurance that includes medical evacuation coverage. It's inexpensive compared to the cost of being airlifted from another country, which can easily run over $100,000. And now, perhaps the biggest financial gap of all long-term care. Medicare does not cover assisted living, nursing homes, or long-term custodial care. It might cover a short stay in a rehab facility after hospitalization, but that's it. If you need daily help with dressing, bathing, or eating over the long term, that's considered personal care, not medical care. This is the number one area where people go broke in retirement. The average cost of assisted living in the U.S. is about $60,000 a year and double that for private nursing care. To protect yourself, consider long-term care insurance, or newer hybrid life insurance policies that include long-term care benefits. Starting early can dramatically lower your premiums. Here's another area people often overlook: concierge, or boutique doctor memberships. You've probably seen them advertise: doctors who offer 247 access, same-day appointments, even personal wellness coaching for an annual fee. Those membership fees aren't covered by Medicare. Even if your doctor accepts Medicare, that extra fee comes straight from your pocket. However, any actual medical services provided by that doctor, like exams, tests, or procedures, still have to be billed to Medicare normally. So before you sign up for a concierge service, make sure you understand exactly what you're paying for and decide whether it's worth the cost. The truth is, Medicare is an incredible program, but it was designed decades ago for a very different healthcare landscape. It covers the essentials: hospital stays, doctor visits, preventive screenings, but it doesn't cover many of the services that people rely on to maintain quality of life as they age. The good news is, you have options: supplemental insurance, Medicare Advantage plans, private coverage, or even just proactive budgeting can help fill these gaps. The key is planning ahead before the bills arrive. So here's the bonus strategy I promised. Do a personal Medicare audit once a year. List every recurring health cost you have: dentist visits, eye exams, hearing care, prescriptions, foot care, travel, anything, and check which ones are covered. Then match your coverage to your lifestyle. If you travel, prioritize global coverage. If you value holistic care, pick an Advantage plan with alternative therapy benefits. The best plan isn't always the cheapest, it's the one that fits you. Medicare gives you the foundation, but it's up to you to build the rest of the structure. If you're proactive, you'll avoid nasty surprises, protect your savings, and maintain your freedom to live the way you want. If you found this video helpful, give it a thumbs up and share it with someone who's turning 65 soon. It might save them from an expensive lesson. And if you want more content about retirement planning, healthcare, and financial strategies that actually work, hit subscribe and turn on notifications. Thanks so much for watching, and remember, being informed today is the best insurance for tomorrow.